Your gums are bleeding when your gums are bleeding when you brush. You're getting mouth sores. Your teeth feel looser, and your dentist keeps asking if you're flossing, which you are. If you're in your 40s or 50s, this might be a dental problem, and it might be perimenopause. Today I'm talking about something no one warns you about. When menopause do, what menopause does to your mouth. And yes, bleeding gums are just the beginning. Now, do gums bleed during menopause? The truth about oral health. Hello and welcome to Creatively Miss Me, Healthy Tips and More. I'm Stephanie and I'm glad you're here. If you're looking for real practical advice about living healthier without all the confusion, then you're in the right place. About a year ago, my gums started bleeding every time I blushed. Then Then I noticed one of those little ulcer things on my gums and it was really sore. Then my dentist said that I was having gum inflammation, even though I was brushing and flossing regularly. So I was confused until I connected the dots. I was in perimenopause. Turns out hormones affect everything, including your mouth. Today, I'm covering why perimenopause causes oral health issues, the 7 most commonly mouth problems. Bleeding gums is number one. What you can do about it, when to see the dentist versus when it's just hormones. When to see the dentist versus when it's just hormones. Products that actually help. Now let's talk about your mouth. Now, why do hormones affect your mouth? First, why why does perimenopause mess with your mouth? Two hormones, estrogen and progesterone. I can never say those words. Those hormones don't just affect your uterus, they affect your gums, the blood flow, and inflammation. Your saliva production, your bone density, including jaw bones, your oral tissue and thickness, your immune response in your mouth. When estrogen drops during perimenopause, gum tissues become thinner and more sensitive. Blood flow to the gums decreases. Your product of less You produce less saliva. You get the dry mouth. Your mouth's ability to fight bacteria decreases. Bone loss can affect your jaws and your teeth. Basically, your mouth becomes more vulnerable to inflammation, infection, and damage. And most doctors never mention this. Most dentists never connect it to menopause or perimenopause. So you think something is wrong with you, but it's just hormones. 7 oral health problems from perimenopause. Now, here are the most common ones. Problem number 1, bleeding gums. Now, it's not common. That's the most common one. Problem number 1, bleeding gums. It's the most common. Your gums bleed when you brush, you floss, or even when you eat crunchy foods. Why it happens? Decreased estrogen equals thinner, more fragile gum tissue. Increased inflammation responses and reduced blood flow to the gums. This is called menopausal gingivitis. Oh Lord. Let me look and see what this word is. GINGIVOSTOMATITS. Gingivitis. Basically, menopause related gum inflammation. Now, what you can do about it. You can use a soft toothbrush, not a medium or hard. Gentle brushing techniques. Salt water rinses, 1 tablespoon of salt in warm water twice daily. CoQ10 supplements that helps gum health. See dentist for rules on out. See dentist to rule out gum disease first, okay? Problem number 2, dry mouth. Your mouth feels like cotton. You're constantly thirsty. Food sticks to your teeth. Yes. Now, why this happens? Estrogen affects saliva glands. Less saliva production equals dry mouth. Can also be from medications. That's true. One of my medications does cause dry mouth. Now, what to do? Drink more water. Aim for 8+ glasses a day. Sugar-free gum or lozenges. They stimulate saliva. Avoid alcohol-based mouthwashes. They dry you out more. Humidifiers at night. Biotin products made for dry mouth. Talk to your doctor about saliva substitutes. Problem number 3, burning mouth syndrome. Now, I haven't had that one. Your tongue, the roof of your mouth, or your gums feel like they're burning. No visible cause. Now, why this happens is hormone changes affects nerve endings in the mouth. Often worse in the morning, improves during the day. Can feel like you scald your mouth with hot coffee. Now, what to do when this happens? Avoid spicy foods, acid and hot foods. Suck on ice chips. Take B vitamins, especially B12.
of this molecule, both in British English and in American English, as the two pronunciations differ. This is the active component of chili peppers. How do you go about pronouncing it? In British English, this is normally said as capsaicin. You do want to stress on the second syllable, on the say syllable. Capsaicin. Capsaicin. In American English, however, this is normally pronounced as capsaicin. Capsaicin in American English.
Capsaicin rinses. Yes. Really ask your dentist. Alpha lipoic acid supplements. Studies show that it helps. Now, rule out other causes of fungal infection or vitamin deficiency. Problem number 4, altered taste. Food tastes different. Metallic taste in your mouth. Can't taste things as strongly. Now, that happened to me for a little while, but then we figured out what it was. Why it happens. Hormones affects taste buds. Dry mouth reduces ability to taste, and zinc deficiency is common in perimenopause. Now, what to do about this? Zinc supplements. Talk to your doctor about dosage. Stay hydrated. Use stainless steel or glass, no plastic, for foods or drinks. Wait it out. It usually improves. Keep food interesting with textures and temperatures. Problem number 5. Problem number 5. Mouth sores, which are the canker sores or the little ulcers. It's a sore spot that won't heal. Okay, now why it happens is a thinner oral tissue equals more prone to injury. The immune system changes. Stress, which spikes during perimenopause. Now, what to do about it is to avoid acid, spicy, and rough foods. Use a soft toothbrush. Take vitamin B12 or folic acid. OT canker sore gel from Oragel or Orbicel, they work wonders. Salt water rinses. If it doesn't heal within 2 weeks, see your dentist. Problem number 6. Teeth sensitivity. Hot, cold, sweet. Everything hurts your teeth. I went through it with the cold for a minute. Now, why this happens, it reducing gum exposure to tooth roots. And it would close, right? And I was going to hit pause. Now, why it happens, receding gums expose tooth roots. Enamel thinning from dry mouth and acid grinding. Bone loss affected from tooth support. Now, what to do about it? Synedrone or a sensitive toothpaste. Use it 2 per week to see results of your doctor. A fluoride rinse. Avoid acidy foods and drinks. Use a soft toothbrush and see your dentist. This might need a fluoride treatment. Problem number 7. Loose teeth, jawbone loss. Yeah, jawbone. Teeth feel looser. Bite feels different. Jaw pain. Now, why does this happen? Estrogen loss, bone density loss, including in the jaws. Yeah, I didn't know that. I found that out myself. Can lead to tooth loss if severe. Same process as osteoporosis, but in the jaws. Now, what to do about it? Calcium and vitamin D supplements. Weight bearing exercises. Yes, it helps bones everywhere. Dental x-rays to check bone levels. May need periodical treatment. HTR can help with tooth. Talk to your doctor. HTR can help, so talk to your doctor. Don't ignore this. It can lead to tooth loss. When to see the dentist. How do you know if it's perimenopause or actual dental disease? Now, if you're bleeding and it's severe and constant, you have pulse or swelling, the teeth are visibly moving, the pain is severe, Sores don't heal within 2 weeks. You have a loose tooth. Your bite has changed. You have bad breath that won't go away. You need to rule out gum disease or cavities, infections, oral cancer, rare but possible. Now, it's important to tell your dentist that you're in perimenopause or menopause. Many, hello? Hello? Now, it's important to tell your dentist that you're in perimenopause or menopause. Many dentists don't think to ask, but it matters for treatment. Now, things you might need: a professional cleaning, a scaling of the root plan, which is just deep cleaning, fluoride treatments, prescriptions to strengthen the toothpaste, prescriptions of a strength prescription prescription strength toothpaste, saliva substitutes. Don't skip dental appointments. Perimenopause makes you more susceptible to gum disease, not less. Here's your daily oral care routine for perimenopause. In the morning, brush with a soft toothbrush, gentle circular motions for 2 minutes. Number 2, use sensitive toothpaste if needed. Number 3, floss gently, don't snap it against the gums. Number 4, rinse with alcohol-free mouthwash or salt water. And number 5, drink more water. Now, after meals, number 6, you rinse your mouth with water. Number 7, chew sugar-free gum if you have dry mouth. And number 8, drink more water. Before bed, brush and floss. Number 10, fluoride rinse is sensitivity. And number 11, water by your bedside in case you get thirsty during the night. Now, supplements that may help: CoQ10, 100 to 200 milligrams daily. Omega-3, it reduces inflammation. Vitamin D plus calcium, bone and gum support. Vitamin B complex, especially B12 for burning mouth or sores. And zinc for the taste changes, immune support. Now, stop smoking. It makes everything worse. Limit your alcohol if you have dry mouth. Reduce sugar. Feel Reduce sugar. It feels bad. If Reduce sugar. It feeds bad bacteria. Stay hydrated. 8 plus glasses a day. Manage stress. Worsens inflammation. Regular dental cleanings every 6 months maximum. Now, here's some things that are worth trying. Biotin dry mouth products, Sensodyne sensitive toothpaste, and CoQ10 gum gel. X Limits, I'm going to put the name on the screen and say if I'm saying this right. It's for a dry mouth disc for nighttime. Electric toothbrushes with a gentler manual, okay? Water flosser is easy for sensitive gums. Now, does HRT help? Short answer, yes, for some women. Hormone replacement therapy. Let's move it again. Hormone replacement therapy can help oral health because it increases can help because it can help oral health because it increases estrogen and improves gum health. It increases saliva production, reduces inflammation, and helps maintain bone density in jaws. Studies show that more women on HRT have less gum disease, less tooth loss, better bone density in the jaws, and fewer oral symptoms. But HRT isn't right for everyone. So talk to your doctor about it first, especially if you have specific symptoms. Your risks are higher. Whether HRT makes sense for you, just check with your doctor first. Oral health alone probably isn't enough reason for HRT. But if you're already considering HRT for other menopausal symptoms, know that it can help you with your mouth too. Now, here's what I want you to do this week. Tell your dentist you're in perimenopause at your next appointment. Switch to a soft toothbrush if you haven't already. Start saltwater rinses if you have bleeding gums. Add CoQ10 to your supplement routine and drink more water. Then come tell me in the comments, are you experiencing any of the other oral hits? Are you experiencing any of these oral health issues? Which one is it, and which one is the worst for you? Do you think that hormones affected your mouth? And download my free perimenopause oral health guide. It has a complete symptom checklist, daily care routines, supplement guides, and when to see the dentist flow chart. Links are in the description. Nobody warns you that perimenopause affects your mouth. We hear about hot flashes, night sweats, mood swings, but not bleeding gums or burning mouth or tooth sensitivity. Those catch you completely off guard because it did me. But now you know. This is normal. But now you know. This is normal. This is hormones and it's manageable. You're not crazy. Your oral hygiene isn't bad. Your body is just changing. Take care of your mouth. It matters. And you deserve to know what's happening and why. You've got this. Now I'll see you here again next week here on Creatively Miss Me. Bye-bye.